I am Dr. Rodney Dennis with Urology Centers of Alabama, and I'd like to speak with you today about our kidney stone prevention clinic. Kidney stone disease is a complex medical condition because there are so many different variables which may contribute to stone production from one patient to the next, or even within the same patient. However, there are some basic pieces of information which can help the physician to determine the most likely cause of a patient's stone production, or at least help rule out some causes. Before we discuss prevention, it should first be understood that there are various kinds of kidney stones. Just as an ice cream with various flavors, and kidney stones, there are different ways the body forms different stones. Many, but not all patients who form stones are presumed to be genetically predisposed. In other words, they have a family history of them. Patients who form stones are very likely to form more stones unless we can determine what may be causing the stone in that particular patient and make the necessary changes to avoid another one. Urologists are trained to successfully treat kidney stones. However, at the Urology Centers of Alabama Stone Prevention Clinic, we are dedicated to determining why the patient may be forming stones and how to prevent another one. We have developed a systematic approach to accomplish this goal. First, if patients have a symptomatic stone or one that has a high likelihood of becoming symptomatic, we treat the stones. At the same time, we review a dietary and lifestyle questionnaire, which we have specifically developed for this clinic and which takes only a few minutes to complete, but can be very helpful at determining some significant causes of kidney stone formation. We try to focus only on simple and basic nutritional or dietary changes because more complex and in-depth nutritional changes are less likely to be continued by the patient in the long run. If the patient has had only one stone, we proceed more conservatively with the basic dietary changes, review basic lab values, determine stone composition if possible, and monitor on a regular basis. If patients have multiple or recurrent stones, we do the basic evaluation, but also consider a 24-hour urine collection for metabolic evaluation to try to determine what might be going on in the patient's body to cause the stones. Depending on those results, we might consider further dietary recommendations or a medicine to help prevent stones, or occasionally a repeat 24-hour urine with sodium and calcium restriction to further clarify the cause. There are several different medicines available to help prevent stones, and our results will help determine if one is even needed or which medicine or combination of medicines might be the most appropriate. We've also developed a computer template into which we can plug in known information about the labs, stone composition, and 24-hour urine results to help the physician determine the most likely cause of stone formation and guide the physician in making the most appropriate recommendations. Our goal in the Urology Centers of Alabama Kidney Stone Prevention Clinic is to help the patient avoid ever having a new kidney stone. Thank you.